I started becoming psychotic, and I started to hallucinate.
It was like our world was just unraveling.
She had this weird sense of power behind her.
It was almost a helpless feeling.
What are we going to do?
I realized we could be losing her.
Welcome to Something's Killing Me. I'm P.D. Wong. Imagine you are young and healthy and living your life, attending school, going to work, enjoying your family and friends. Life is good. But in the blink of an eye, it all changes. And suddenly, instead of living your life, you're fighting for it. You find yourself feeling anxious, becoming paranoid, experiencing hallucinations, and the scary part is, doctors can't figure out why you are descending into madness.
I remember when I was in medical school, there was a term that people would often write in charts, and it was GOK. And it means God only knows. That's what it means. And people would write that as a shorthand to say, I don't know.
Madison was like any other 6-year-old, very sweet young lady, and just a great personality.
She's always been very outgoing, very talkative, way more mature than she ever should have been for her age.
She was just like a teacher's dream. She was responsible, she was respectful, she could follow directions. She was eager to learn. And unlike a lot of kindergartners coming in, she was already reading, and she could count.
When everything first started, she was in kindergarten. We went to Disney World in October. She had a lot of bowel accidents. It was so out of character for her. She had been potty trained for almost 4 years by that point, and her behaviors were a little erratic. And then when we got home from Disney World, the behaviors continued and they intensified. Tantrums. She had never been a kid that had tantrums.
She was having a 2-hour episode of being unconsolable, irritable, agitated, violent in her behaviors.
Lots of yelling and screaming, I hate you, those sorts of things.
It was just a kind of scary time because you didn't really know what was going on, but you knew something was wrong.
She had this weird sense of power behind her, and we didn't want her to hurt herself. We didn't want her to hurt her sister, to hurt us.
The part that I will never forget was when she was underneath the table. She was scared of everything. If we would come near her, she thought that we were going to be mean to her or hurt her.
From then on, I started communicating with her teacher because I thought, if we're seeing these things at home, surely this is happening in school.
When we were in whole group, the kids are sitting on the floor, and I looked over at Madison, and her mouth is twitching, and she kind of has some red splotches on her face, too. And I said, Madison, are you okay? And it's like she panicked, and she just started spitting like a whole bunch of saliva.
The next day, I got an email from her teacher that said, something maybe is a little off.
She was having a lot of trouble even speaking. She knew what she wanted to say, but she couldn't get it out. And then all of a sudden, she just started this gibberish, and then she vomited. And then I was like, okay.
And so I met with her teacher after school, and she said, you need to take her to an ER. You need to, I think there's something wrong with her. We saw a doctor, and the doctor checked her over, and she said, there's nothing physically wrong with her. I think you need to be seeing a psychiatrist or a psychologist. She's probably schizophrenic.
Schizophrenic? How do you diagnose schizophrenia in a child? Like, it just didn't make sense. It's like there was too many pieces of the puzzle that we still hadn't figured out to just go with such a meaningful diagnosis that was going to affect the rest of her life.
Things got worse and worse at home. She was confused a lot of the time. We were at a point we were struggling just to survive and get her to bed at night and get some sleep and move on to the next day where we started it all over again. I started reaching out to behavioral therapists. Maybe they can tackle, are we doing something wrong as parents? Is there something more going on medically? What is this?
We were spending hours on the internet doing reading and research, and it just was almost a helpless feeling of, what do we do? How do we go about this?
Because the behaviors had changed so much and had gotten so unreal and unbelievable, I started videotaping her.
Hey, you're gonna hurt yourself. Can you relax a little? I don't want you to hurt yourself.
Right now, this has gone on ever since she got up this morning.
Hey. Hey, come down with me.
We began videoing, and we went to Dr. Connie armed with these videotapes. Because I thought, this lady's never met her before. She has no idea what she's normally like, what she used to be like.
When I walked up to her in the lobby and extended my hand to shake her hand, she looked at me like she had no idea what was happening.
Could you go lay down? Yes? No?
What's the matter?
Sometimes she seemed to be tracking pretty good, and other times she would just look very confused.
At the end of the appointment with Dr. Connie, she said, okay, this is not a behavioral health issue.
There's something else wrong. And I said, I can't tell you what's wrong with her, but I'm very confident that there's something medically wrong with her.
I said, okay, like take your breath away type of moment. How serious are we talking? Do we need to be going straight to the hospital?
I know Maddie very well, just been taking care of her for so long. When you'd look in her eyes, there was an absence there.
We pleaded with him, help us figure this out. What's wrong with her?
6-year-old Madison Jensen has been deteriorating for months. She was a vibrant, smart, sweet little girl, but now was having violent temper tantrums. She began drooling, and eventually she was no longer able to read. Madison's parents were desperate to find out what was wrong.
Mandy and Corey had that look to me as, something's wrong with Madison. We gotta fix this, because this is not our baby. And knowing Madison and taking care of her since birth, I said, you're absolutely right, and we got to put her in the hospital.
He sent us immediately to Children's Hospital, where he ordered an MRI.
At the time, my thought was, could we have a brain tumor? Do we have a seizure disorder?
So they immediately got her admitted and took her down for an MRI. I sat in the MRI room with her and just waited and thought, this is the day our lives are gonna change.
I was very worried for Madison. I was worried that we weren't going to see her come back to her normal self.
10:30 that night, Dr. Fran called me, and he said, I want to tell you, they did not find any sort of massive tumor on her brain. Thank God, that was our worst fear. But okay, now what? Like, it's not that, so now what?
Madison's parents didn't know what the future was going to hold for their little girl. Meanwhile, just over 1,000 miles away in Wilkes-Barre, Pennsylvania, the parents of 19-year-old Emily Gavigan were living a similar nightmare.
It was like our world was just unraveling. It happened quickly. Just a couple of months, we had gone from having this, daughter who was perfectly normal, happy, vibrant, with a bright future ahead, and then all of a sudden, it all came crashing down.
Happy birthday to you.
Make a wish. Emily, growing up, was just a wonderful, wonderful child. She was very loving, enthusiastic, friendly, great little girl.
She liked to dance. She was a cheerleader. She loved to ice skate. She just seemed very happy all the time.
She did develop quite a bit of anxiety over making the college decision primarily, and all the other things that are thrown at 17-year-old kids these days as far as, trying to make life decisions.
Emily started to see a psychiatrist on an as-needed basis for anxiety.
She graduated from high school, top of her class, and went on to the University of Scranton. Then in her sophomore year, early January of 2009, we had noticed something was changing with Emily.
She would ramble, very fast rambling, wasn't really making sense.
Emily just continued to get worse, to the point where Grace and I were concerned about her safety. She actually got in her car the one day and drove and would not answer her phone. We didn't know where she was for more than 24 hours. We came to find out later on that she'd driven to New Jersey from Pennsylvania, and she thought that a car was following her, people were out to get her, and ended up driving herself to her grandparents' house, where she had just appeared and just was hysterical.
Emily came in and she says, "Grandpa, somebody's following me." I hugged her. I says, "Somebody's following you. Grandpa will take care of them." So I made out. I was looking outside. I think that was the start of her getting ill. We just couldn't. I get emotional when I think about it.
We drove over and she was curled up on the couch and very frightened, very scared. That night, right then, I called her psychiatrist and told her this odd change in Emily's behavior. And she sent a prescription to the pharmacy and said, have her start this, watch her for a few days, and I think she gave us an appointment to come back in a week. The next morning, we did have tickets to go see a show, and we decided, Emily seemed fine in that she wasn't frightened. Her behavior had calmed down quite a bit, so we thought, let's just go about our business.
Sounded like a good idea until we were on our way.
We were about 20 or 30 minutes into the trip, and Emily turned around and said, "Dad, this blue car, it's following us," and it started again. And, they're just behind us. It's going the same direction. It's, it's not after us. And we knew we had to turn around.
We started to see that something was terribly going wrong with her.
On our way home, I called the psychiatrist. It was a Saturday morning, and I called her from the car. She opened the office and met us there. And after speaking to Emily for a few minutes, she said, "I recommend you take her to the emergency room for an evaluation and possible hospitalization."
We went to the emergency room of the local hospital, where she was evaluated and ultimately admitted to a local mental health facility. Emily was 19 years old, so she was an adult. My wife and I didn't realize that when we turned her over to the mental health facility, we were no longer part of her care. We were pretty much blocked out of seeing her for 72 hours.
You want a diagnosis, you want a name, you want to know what is going on with your child.
When we first showed up at the hospital, Emily was like a different person. We didn't know who she was. She was so heavily medicated, we could barely talk to her. They just kept saying, "Give us time. We see this all the time. We just have to get her medication right. She's going to be fine."
No.
And they just kept trying medication after medication after medication, and none of it worked.
Emily was in that first psychiatric facility for about 2 weeks.
They mentioned bipolar disorder many times, but it ended up being psychosis unknown. So they didn't know what to do with her, so they gave her back to us and said, "She's getting better. She'll be fine. Just tell her to take her medicine. Make sure she takes her medicine."
Emily wanted desperately to get back to her life, to get back to school, to be normal.
One of Emily's professors expressed grave concern over her bizarre, odd behavior. They told us that we should probably make sure that she's ready to come back before we send her back to school. She would have periods of paranoia. She would really be just very, very aggressive towards us and hateful and just certainly all the things that she wasn't. We thought that we would bring her for some more inpatient care for her own safety and hopefully to get to the bottom of what her issues were. This was absolutely the worst decision we had ever made. It was just an awful, awful, terrible place. I liken it to the movie and book, The One Flew Over the Cuckoo's Nest. And once again, Emily was an adult. She admitted herself, and we were kind of on the outside of her care.
They told us that Emily had, they didn't know for sure, psychosis. It was either leaning towards schizophrenia or bipolar, that she'll probably never work, and we should probably just get Social Security for her and take her home.
How you feeling today? Okay. Emily was almost catatonic at this point. I said to Grace, I said, what are we going to do?
I remember looking at my husband and saying, well, we'll take her home, we'll love her.
See, I love you, Dad. Yeah. All right, love you. That's all we can do. So we brought her home, and that's what we thought we were going to do. We're just gonna love her and do whatever we could for her. We thought, this can't be. There's got to be another answer here. You know, why did this happen so rapidly? Why did this perfect person, perfect, wonderful child, why did this happen? I looked at her and I said to Grace, I said, I don't think she's going to live till tomorrow morning.
Welcome back to Something's Killing Me. I'm B.D. Wong. When Corey and Mandy Jensen found out their 6-year-old daughter, Madison, didn't have a brain tumor, they were, of course, relieved. But now what? No one could figure out what could have caused the dramatic and horrifying transformation in their daughter. Halfway across the country, Emily Gavigan, once a thriving college student, was experiencing nightmare symptoms of her own.
In January 2010, full year after the initial onset of the symptoms that Emily suffered, I got a call from my sister at work, and she told me that she had seen the Today Show that morning.
Susanna Cahalan is now feeling 100%.
And a young woman named Susanna Cahalan had this mysterious illness.
Who knows how many people out there are suffering from what I suffered from and are just not getting the diagnosis that they need. Doctors estimate that about 90% of people out there are undiagnosed.
Susanna had written an article in the New York Post, and it turned out that she had very similar symptoms to Emily's sudden onset of psychiatric symptoms that turned out to be a medical issue that could be treated. So I took the information and I sent it to Emily's psychiatrist along with a note.
He said, who sent me this article? And my husband said, I did. And he said, I believe that you're in denial about your daughter's mental illness.
That's outrageous. When you have someone with a mysterious illness that no one can quite explain, you should be welcoming input from the patients, not scolding those patients.
Throughout this, Emily was having her ups and downs, but all through she was very motivated to get back to school. And ultimately, her focus on that was a very positive thing because she was able to get back to school in the fall.
And then in March, she came home from spring break. She was eating a pint of chunky monkey. and the ice cream was hard, and she was holding the spoon in such an odd way, trying to get the ice cream out of the container, and she would laugh. And I said, Emily, what are you doing? And she just laughed.
Turns out that she couldn't use her right hand. So once again, another symptom. Well, we don't know what this means.
We called a family doctor at that point, and he sent us for an MRI. Our family doctor asked that we just stay there, that the radiologist would call him with the result, and then he would call us. And he did, and he said, Emily has MS.
Emily gets admitted to the hospital. A neurologist begins the treatment for MS. We were probably the first and only family in the history of diagnoses to be happy that our child may have MS, just because we may have an answer.
They discharged her with intravenous steroids to be administered at home as a treatment for MS. And within a few days, I was with Emily. We went to pick a few things up, and she started to stumble. And I realized she didn't trip, that she was starting to have difficulty walking. I called my husband, and I said, we have to go back to the emergency room. Something is not right. We got to the emergency room at Geisinger. She was seen by Dr. Gross, a neurologist.
She had been through quite a bit with psychiatric symptoms such as paranoia, difficulty with speech, difficulty with language. She was clearly not communicating as somebody her age should.
Emily in the hospital, Geisinger.
What didn't fit in terms of her diagnosis being multiple sclerosis was that she had many too many white blood cells. With MS, we rarely see over 20 or 25 white cells. And she had 183 or 190 white blood cells.
You're being recorded now. When Dr. Gross told us that he wasn't sure what was going on here yet, but he was sure it wasn't MS, we just couldn't believe it.
They did take her for a CAT scan at that time, and they found a large blood clot in the middle of her brain. So Emily became very critical very quickly.
Part of our concern was, how do we help her right now, because she was obviously having symptoms day by day that were getting worse.
I realized we could be losing her.
They got Emily stabilized from that, brought her to the ICU, and Dr. Gross stayed behind at my request, and it was just the two of us in the room. And I handed him the article that Susanna had written in the New York Post.
The article gave us information about what the disease might be, although we certainly weren't sure that that's what it was at that point. And also it gave us a source of who knows a lot about this disease. It mentioned the University of Pennsylvania. And
I guess sometimes you have a feeling, I looked at her and I said to Grace, I said, I don't think she's going to live till tomorrow morning. And about 2 hours later, she flew away in a helicopter to the University of Pennsylvania.
It's fair to say that she came here at death's door.
And they put her on the vent right in her room. And then I'm thinking, we're going to be unplugging this like in the next couple of days, and she's going to die.
April 20th, 2010, Emily on a ventilator.
She had tubes, IVs, and the blood pressure cuff, and hooked up to a heart monitor.
Grace looks at me and says, how much more can we take? And I said, apparently a little more. We have to. They got her to a point where they felt there was a window of opportunity that they could test her.
They could temporarily take her off the blood thinner to get the spinal tap to do the test. I think within the week, we got a diagnosis, and when they told us her particular kind of autoimmune encephalitis is anti-N-M-D-A receptor antibody disease, we had to ask them to write it down because it was a mouthful.
And this wasn't somebody's guess. We knew this was true.
They came to visit Emily in the hospital.
And it's an awful disease. It's an awful diagnosis. But we were euphoric to finally finally have a name for it.
These autoimmune encephalitis occur as a result of an immune response that unfortunately intended to fight off a bad target hurts a good target. And in these instances, it turns out to be the brain that's the good target.
The body, for whatever reason, has decided that something that should belong there does not belong. And the body starts to attack it.
The body is attacking the brain.
Everybody was cheering. We had a diagnosis of autoimmune encephalitis. Now they knew what they could treat me with to get me better. The plan was to treat me with rituximab, which is an immunosuppressant. And they were hoping that that would lessen these antibodies that were attacking my brain and causing the encephalitis.
The treatment for AE belong in the class of cancer drugs because cancer drugs also suppress your immune system.
During my recovery, I was very determined. I wanted to get better. I wanted to work to get better. I took it on as my job.
When someone's recovering from a neurologic diagnosis, particularly as something as severe as Emily was undergoing, it's rocky progress.
After being sick for more than a year, Emily Gavigan is finally diagnosed with anti-N-M-D-A receptor autoimmune encephalitis. Emily and her parents say if it wasn't for Susanna Cahalan, Emily may never have been properly diagnosed.
My name is Susanna Cahalan. I was 24 when in 2009 I was diagnosed with anti-N-M-D-A receptor autoimmune encephalitis.
When I got to see Susanna, after a few weeks already hospitalized, she was severely impaired from a neurological standpoint. There was a possibility that Susanna may end up in nursing home or locked up on psychiatric ward or even facing death. This is a disorder characterized by inflammation of the brain caused by misguided autoimmunity. Susanna's own immune system start misfiring erroneously against her own brain tissue.
Recovery is a very complicated one step forward, two steps back process. When I was released from the hospital, I could not read and I could not write and I could hardly walk.
The majority of our RIA patients go to brain injury programs in acute rehab hospitals where through intensive therapy, physical therapy, occupational therapy, they are given the opportunity to relearn what the brain injury took away.
7 months after my diagnosis, I went back to work. I was still not fully there, and the New York Post was really kind to me. My colleague, my friend, went to my editor and said, you should have her write about this. It's really interesting. So I wrote that story, and the response was incredible. It's terrifying. I had this mission now, and that's when I went on the Today Show and talked about my experience, and then the response was even more incredible. And at that point, I knew, okay, I have to write a book.
I'm Emily Gavigan, and in 2010, I was diagnosed with NMDA receptor autoimmune encephalitis. While Susanna was writing her book, Brain on Fire, she asked if she could interview me and my parents to be in the book. So the first time I was able to meet her in person was when she came to my house to interview us. Meeting her and realizing if she wasn't able to tell her story, I wouldn't have gotten a diagnosis. And that connection, it was just surreal.
I wrote Brain on Fire in 2012. I don't think I really thought it would be read. And then it came out, and I started getting emails. And I started getting flooded with emails from people who needed help.
We were invited then back to the Today Show, telling the story about how Emily was diagnosed through Susanna's story.
Susanna, I'm just so thankful for her. If she hadn't been here, then I probably wouldn't be here. And the way we can relate about what we've gone through, too.
Emily would not be with us today if Susanna did not bring that information to the masses.
By writing about her battle with autoimmune encephalitis, Susanna Cahalan was able to help save Emily Gavigan. But can she help Madison Jensen? The 6-year-old from Omaha, Nebraska, was now in the hospital fighting for her life.
Corey and I decided, all right, they don't know what they're doing. Like, they don't know what to look for next. Let's start researching.
Doctors cannot figure out what's wrong with Madison. They do all sorts of tests. They test her for a seizure disorder, and she doesn't have it. They look for a brain tumor. There is none. Her parents at this point are terrified.
I brought up my Yahoo Mail, and on the front page of Yahoo Mail, there was this thing about brain on fire. We stayed up until all hours of the night researching.
When Madison's mom read that book, she said so many of these symptoms match up. Her daughter's experience in many ways was very similar to Susanna's.
The next morning, a doctor came in and I mentioned it to her, and she said, no, we've tested kids for this disease before and nobody's ever had it. It's super, super rare. No. And she totally blew me off.
During that time, we were contemplating other diagnoses as well, because we just weren't seeing Maddie see any improvement. And in fact, probably worsening.
After they unhooked her from the EEG equipment, this other doctor decided to run a spinal tap. And I knew that the only way to test for anti-NMDA receptor encephalitis was through a spinal tap. So I thought, okay, great, here we go. I might get my way here.
When we got the lab values back that showed the abnormality in the serum for NMDA receptor encephalitis, we went with that diagnosis.
Madison was in the hospital for about a week with getting alternating IVIG and IV steroids as first line of treatment. She responded really well to the treatment.
They figured out that I had anti-NMDA receptor encephalitis. Now the doctors knew what to do.
The uncertainty and the unknown was probably the scariest. But then getting the actual diagnosis, having that knowledge, was such a huge relief, because it was finally like, yay.
I really think that Susanna, in writing the book, is the one who started to create the awareness. Without that linking Emily and Emily linking Madison, I don't know if we'd have ever got the correct diagnosis.
They helped me when they were on the Today Show. So like if it keeps like going, then maybe we could help someone, and then they could also be on something, and then it'd just keep going. It'd be like, it's like a chain where it's just keeps spreading, and then a lot of people will know about it.
Every time I see or talk to Emily and Susanna, I don't know, I get super emotional, because they saved her. I mean, really, they saved Madison's life.
One of the things that we decided to do was put together a book with Madison. And when I talked to her folks about it, part of it was to help so they would have the information, but part of it was also to kind of help her process.
One day, everything started to change on the outside. Things started to get fuzzy in my memory, and that is why I helped write this book.
I think she's one of the toughest kids I know. I mean, she's been through really a lot of unknowns. I mean, I think it's made her tough.
AE can be deadly. It can be deadly if not treated in some way. It's a situation where the body is attacking part of itself. But as that process gets worse, it can spread, and it could potentially cause death.
Back in 2005, we have 5 cases. In 2007, we have around close to 10 cases. And in 2010, there was presentation of around 100 cases. And now we have thousands and thousands and thousands of cases. The rising incidence of AE is largely due to rising awareness.
Misdiagnoses are common in medicine in general, and maybe a little more common in neurology, because there's certainly a lot of mysteries about the nervous system that we really don't understand.
I have no doubt in my mind some of those patients in the past, either placed in nursing home or locked up on psychiatric wards. And unfortunately, many of them died from unexplained mysterious disease, often mistaken as intractable psychiatric disorder, psychosis, or schizophrenia.
At this point, I don't know whether Emily is cured from her disorder. For some patients, your immune system, for unclear reasons, may get reactivated. And if it gets reactivated, it may then produce further antibodies to target the neuronal receptors and hence cause a relapse.
Emily did, in fact, have a relapse a couple of months after being released from the hospital. She was laughing inappropriately again. She was just a little bit combative, aggressive, went back to the hospital and was treated with some more Rituxan and just got back to school with no issues.
I do every day think of the possibility of another relapse. I'll say to my husband, Bill, did you talk to Emily today? How did she sound? Or he'll say to me, did you talk to Emily? Is she okay?
I've realized how strong I am and how much support I have from my family and friends, but really that I can handle anything. I worked hard to get back to where I wanted to be, and I'm here.
With NMDA receptor encephalitis, about 80% of the kids get back to baseline within 2 years. Madison is now a 10-year-old, totally back to baseline in terms of her behaviors and her movements and her speech and her learning capabilities.
She definitely is incredible to have overcome what she did and be the person she is today.
I like school a lot, and I like to read. I like social studies and history because I really like learning about what's happened in the U.S. and stuff over time. And we have a pool, so we swim a lot in the summer. I'm on a diving team. We dive off diving boards and do tricks in the air. And then I'm on a soccer team, and I really love soccer.
Sometimes I look at her on the soccer field and think, wow, 4 years ago, I'd have never thought we'd have been back here again.
I want to be a professional soccer player or a doctor.
I think it's really important to spread awareness about autoimmune encephalitis, and so few people are aware of this illness that I want others to know about it so that what happened to me doesn't happen to anybody else.
Even if luck is on your side with this disease, you can still die. If I had been sick 4 years before, I wouldn't have been diagnosed because there wouldn't have been a diagnosis that existed. So that begs the question, what else do we have to learn? What's down the line? And I'm an optimist, so I think we're going to make great advances. I do. I know how lucky I was, and my goal became to make sure that everyone is as lucky as I am.
Anti-N-M-D-A receptor autoimmune encephalitis was discovered by Dr. Joseph Dalmau at Penn Medicine in 2007. And since then, thousands of patients have been diagnosed. Now, there's a lot we still don't know about this disease, but this is what we do know. The majority of cases occur in young adults and children, although cases have been diagnosed in people in their 80s. Also, females are about 4 times more likely to be affected than males. And most patients who receive a prompt diagnosis and treatment can recover to lead normal lives. But how and why certain people are afflicted is not yet fully understood and remains a mystery. I'm BD Wong. Thanks for joining us. Good night.